You're watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. Big topic today. For those of you that have been told you may need spine surgery, you have to hear what my first guest has to say. Board certified orthopedic surgeon, Dr. Sunny Kim. Dr. Kim, welcome to the program.
Thank you.
So you're a board certified orthopedic surgeon, but you chose just to focus on spine?
That's right. You have to be an orthopedic surgeon first, then decide during your residency what you're going to focus on.
And you say they don't let you do spine surgery right away after school?
Well, no, because you have to have a general background before you start focusing on that subspecialty.
Okay.
So spine is a subspecialty of orthopedic surgery.
All right. Now, you've done 20,000 spine surgeries. Is that right? I joked with you off camera saying you must be exhausted with 20,000 spine surgeries.
But 20,000 spine surgeries over 32 years, not in 2 years.
Right.
So, there's some longevity built in there.
Okay. Now, for people tuning in, we're talking about fusions today. And there's a new kind of fusion. It's not so new to the doctor on the program, but it's done minimally invasively for the first time, I guess, in history. And there's only 30 guys in the country, correct me if I'm wrong, 30 people in the United States that are doing this fusion surgery that's pretty much closed. Is that correct? Tell me about that.
That's right. Most of the fusion surgeries are done with long incisions, and it is very taxing on the patients. And we are doing this now, majority of these cases, minimally invasive fashion.
Is it true that after a spinal fusion surgery, that some of the patients the next day are walking around and even can walk the same day after the surgery and maybe even return to work like a week later in some cases?
That's right. I even had a patient who goes home in 2 hours after the fusion surgery. Now, typical fusion surgery, patient stays in the hospital for 5 to 7 days. Okay. And it's astounding that after this minimally invasive surgery, patients after fusion with the hardware in there, and they're going home in 2 hours.
Is that right? And so now we're talking about pain management today, or eliminating pain. So these patients, is this a very effective surgery for those that are indicated, where some people have no more pain or very little pain?
That's right. For the right patient and for the right diagnosis, this is a superb surgery. I would compare this to putting a cardiac stent in as opposed to doing open heart surgery.
Now, inspired spine. Let's talk about inspired spine for just a moment. Who's the typical patient that you see that's in pain, trying to get out of pain, that you see?
Typical patient would be a 56-year-old, either male or female, who shows up with a chronic disabling pain, either in the back or the neck or in the arms or legs. Very disabling.
Okay. Now, the spine surgeons, are you the doctors of last resort? I mean, don't they send them to you when everything else fails, like chiropractic, medication therapy, physical therapy, and the pain just is not going away? Is that when they see you?
That's right. We are the last resort, because nobody wants surgery. They want some medications or some injections or non-surgical means to feel better.
Now, let's talk about spine surgery for a moment, because I've interviewed your partner, Dr. Abbasi, at Inspired Spine, and I guess there's he says, 1 million spine surgeries done here in the United States, more than 1 million. And of those, 500,000, that means 500,000 are fusion surgeries. He believes, I'm quoting him, paraphrasing slightly, that most of those could have been done this new way. Instead of opening up their back, cutting through muscle tissue, that you can do it with this new minimally invasive procedure. Is that correct?
That's correct, because most of the fusions are in the lumbar spine. And in order to do fusion, you got to put in a hardware. And in order to put the hardware, you have to make a long incision and strip off some muscles in there, cause lots of scarring, lots of bleeding. And this minimally invasive fusion, we can do it almost through small stab incisions.
Is this less
using
than an
guide
hour?
wire.
I mean, less than an hour in some cases?
That's right. In 1 hour surgery will be less than an hour typically, and maybe 20 times less blood loss. So
You know, I have a buddy, and we were talking in the green room, just had a fusion surgery. And he's going, look, my doctor would have told me about this. And I told him, I said, I think there's only 30 guys in the country, in the US, that do I'm calling it closed. What do you call it? Like this minimally invasive fusion surgery.
through the tube. Through the tube and guide wires.
Like 6 tubes or something?
That's correct. But, you know, it's small stab incisions, and we don't even use a typical surgery, for example, use a cautery because there's so much bleeding. There's smoke coming out of patients.
You're burning the tissue. Why? To stop
Because
the bleeding?
stop the bleeding. And we don't need to do that, this minimally invasive surgery, because there's no reason to generate the smoke or use the cautery because bleeding is so minimal. We can get away without using the cautery.
So when it comes to spine surgery, you told me on the phone that I think you said, like, you took a lot of pride as a big open surgeon. Like, you weren't afraid to really open people up. And I guess you were opening up their back and their abdomen to get a better view of the spine. Is that correct? Then
That's correct.
You changed. Tell me about that.
I was, you know, it's a matter of principle. In order to do surgery, you need to see what you're doing. In order to see well, you need to make a big incisions, because if you don't get a good view of what you're doing, you're gonna get into trouble, complications, paralysis, you know, get the bleeder you don't want to get, and massive bleeding. So naturally, it's easier to do big surgery with large incisions.
So when you said you were a big open surgeon, does that mean you just weren't afraid to tackle some of the biggest jobs with the spine?
That's right. That's right. And I did many complex spine surgeries lasting more than 10 hours with several feet incisions.
Really?
So I can see better. And, you know, you had to put in multiple screws and rods and all that stuff. And it takes a big incision to accomplish that.
Yeah, but don't you still need all that hardware for a fusion? And how do you get it in through those little tubes? That's the part I'm not getting.
Well, so this minimally invasive surgery that we do nowadays, most of the time for patients, we use a guide wire and X-ray control.
Okay.
And all the screws are cannulated, so they just follow the guide wire. So once you put the guide wire in, everything follows.
Okay.
So that's why we can get away without making a big incisions.
Okay, so a standard fusion surgery could take like what, 3 to 6 hours?
That's right.
Okay. And it's taking so long because you're meticulously like detaching the muscles from the bone, etc., just to make room.
Just make a room so you can see better.
Okay.
And also you have to cauterize. You are controlling the bleeding at the same time you are doing the exposure.
So detaching something and you're cauterizing. So this is like this is what takes most of the time?
Plus, if you make a big incision, then there's also closing time.
Okay.
So the bigger incision you make, it takes longer to put the stitches in. So I put in hundreds of sutures to close a big incision. And if you do minimally invasive surgery, you don't need to waste time closing up the patients.
Okay.
Big wounds. So both ways you save time. Exposure time and closing time.
Now,
So that's a huge.
So in a typical fusion, and by the way, you know, we're talking about, you don't do it this way anymore, but this is how it's done 500,000 times a year.
Typically, 90%, more than 90% of time in the United States currently, that's how things are done. Because I was doing it that way for many, many years.
And that's why the big downtime.
Big downtime.
And you're never the same, is that true? I mean, if you're cutting all those muscles, detaching those muscles from the bone, I mean, aren't they kind of like an internal support, like a girdle? I don't know if this is true. I'm just asking you.
Very, very good point, because you're actually stripping the muscles off the bone where the muscles attach. So by detaching that, you're actually killing the muscles, devascularizing, cutting off the blood supply.
So they're left with a weaker back in a way.
Weaker back muscles, like the Golden Gate Bridge, the suspension, the guide wires, the big cables are compromised, so they are not as strong as they used to be. It's a collateral damage.
Okay.
So you are actually unintentionally doing lots of collateral damage when you do a big open surgery doing a fusion. So we are trying to avoid that by doing this minimally invasive
I've had an
surgery.
orthopedic surgeon on this show. He said, I refuse to fuse. And you think that's because of he knew the damage you're doing permanently to the patient?
That's right, collateral damage. Like when you have a battle, you kill civilians as a collateral. That's a collateral damage. We want to avoid that.
Okay, so you became a convert, is what was, Dr. Abbasi told me about you. He said, how did you, here you are doing 6-hour surgeries for fusions. You hear about somebody doing it in under an hour with no downtime, no cutting of the tissues or the muscles. How did you get involved?
Well, the reason I'm always a skeptic, like a doubting Thomas in the Bible.
Okay.
I'm always a skeptic. So it doesn't matter how, with the minimal collateral damage, with less bleeding and less complication, you accomplish the same thing, doing the minimal invasive surgery, rapid recovery. But more important thing is what's the final outcome. Even if you can do the surgery minimally invasively, after 1 year follow-up, you are not as good as the guy who had the open surgery, then the minimal invasive surgery is no good.
Okay.
So I was waiting
For the results.
for the results, the
data.
follow-up, the data. Yeah, the
Okay.
data, exactly.
And what is the data?
Data is good. Based upon my personal experience of having done several hundred of this, and I can give you some examples of
Yeah.
my patients. The one that the patient comes to my mind is a lady who's 55 years old, and she was a martial artist. But also she had a kidney transplant in, so she was immune compromised. She was taking lots of medications.
And she was in a lot of pain.
And she had a severe pinched nerves in her back, and spine is unstable, and she was basically in a wheelchair.
Okay.
Okay, and that patient, I was very afraid to do open surgery, because if you open her up, she's already immune compromised. She has a kidney transplant, and she's going to get infected.
Okay.
Because open surgery will be like 3-hour surgery in the hospital 5 days, lots of bleeding, and that's high risk surgery. So she was not a surgical candidate. So what I did was this minimally invasive surgery, less than an hour.
A fusion.
Okay.
A
Fusion. Yeah.
Okay.
So I put the screws in. So it took me an hour, and she went home the next day. And after 1 year follow-up, she was out of wheelchair, and she was doing martial arts.
Is that right?
No infection, no complication. And CT scan 1 year after surgery showed that she was solidly fused. She had a very common problem for spinal fusion in the United States, which is at the segment L4, L5, spine breaks down, it starts sliding and pinching the nerve. And
Okay.
people are having severe back and leg pain. If it gets really severe, you cannot walk or even stand.
Okay.
So she had that condition, plus all these comorbidities. In this virus times, we're talking about comorbidities, diabetes, heart disease, but her comorbidity was kidney transplant, immune compromised.
So typically, no surgeon would fuse her.
No surgeon, because still an elective surgery, no surgeon would
too
fuse her.
dangerous.
Too dangerous, because 3-4
But
hours
with the minimally invasive.
she's already a surgical candidate.
So if what you're telling me is true, I mean, logically, it makes sense. So if I'm an orthopedic surgeon, why would I do it the old-fashioned, or it's not so old-fashioned, they're doing it every day. Why would I do a fusion, opening the patient up, cauterizing, doing all that stuff, when I could do it this way? Help me understand that. Why wouldn't they all do this way, if what you're saying is true?
But it takes special set of skills
Okay.
and technique to learn this. So you have to take a time off your practice to
Okay.
learn this, and there's such thing as learning curve. You have to do at least 30 to 50 cases, with under some person's guidance or supervision before you get good at it. And in the medical profession in general has a lot of inertia. If you're comfortable with what you're doing, it's very hard to change that.
Okay.
Okay.
Because I guess putting in the hardware when you're right on top of the spine and then putting it together, are you looking at like a scope or some sort of a monitor?
Video monitor.
So you're doing everything like with scopes seeing inside the body.
That's correct. Using X-ray control.
Okay.
In this particular case, for the fusion, we're using 2 C-arms, 2 X-ray machines, and we're using 2 video screens. So, but you also have to make a small stab incisions in the patients to put the guide wires in and screws in and spacers in.
All right. And so Dr. Abbasi, you work with at Inspired Spine,
Right.
he said that he didn't say stubborn, but you were resistant. But once you sat through, he says, about 50 of the surgeries, partnering up with him, that now you're a convert. He called you a convert, that you can't go back. You can't do it any other way. Can you elaborate on that?
Yes, I'm a convert because I've done 20,000 spine surgeries, mostly open, big cases, scoliosis, complex spine surgeries, osteotomies, just massive surgeries. And so I was comfortable doing that. But then, about 5 years ago, there was minimal invasive spine surgeries coming into into our specialty. So I learned another technique, and I was doing a lot of that as well. And Dr. Abbasi's very ingenious technique is quite new, and I'm always skeptical of a new technique until I see the final outcome. And I dabbled on a few cases like that. I have some complications, so I decided to move away from it. Then I came back, seeing how well his patients were doing.
Okay.
So I asked him to train me with his technique that he developed. So he and I did about 30 cases together, and it's like priming a pump. He got me jump started. Then after that, I was on my own. I've done hundreds of this already, and I have many patients who are very happy. And one level patients, actually, I'm doing most of them as an outpatient. I'm sending patients home in a few hours.
And these are fusions?
These are the
fusions. And they could go home that day?
In 2-3 hours at a surgery center. You're not even a hospital. Like oral surgeon's office, you got a wisdom tooth pulled out. It takes less than an hour with minimal bleeding. So, I would say it's like pulling a wisdom tooth out, having a one level spinal fusion.
Okay. We said 500,000 plus fusion surgeries are being done in the United States. Okay, and they're being done the old-fashioned or that open way, right? But I guess the worst part about it is there's probably another 2 million or more, which we can't put a number on this, that are turned away and saying, you need to lose 50 pounds before we do the surgery. You're too old to do the surgery at 78 years old or 80 years old. And with this procedure, you're saying you could have a high BMI, you could be in your 80s, things you would never touch or dream to touch or do surgery on the old-fashioned way.
Okay, case in point is this lady from Iowa. She had a severe problem, pinched nerve and spinal instability at one spot, which is same common problem as the other patient I just talked about, renal transplant patient. This lady was 91.
91.
91-year-old from Iowa, and she was severely disabled in a wheelchair, not be able to walk.
But 91 years old. I mean, is that really worth it? The risk?
Of course, I think, of course it is, because she is in just terrible pain, unable to do anything.
Okay.
Pretty much wheelchair bound. We cannot just ignore her just because she's 91. The outcome was incredibly good with this 91-year-old, and she didn't need a lot of care or attention for her family members. She was able to live quite independently after that, which was a huge boon for the family members. Before the surgery, they had to take care of her around the clock. Now she can get around pain-free and out of wheelchair and carry on an independent living. How great is that?
That's good. Now, everything we're talking about is covered by insurance, right? Like Medicaid, Medicare, I mean, all these different things. Most insurances are going to cover this.
That's right. It's a well-recognized problem. Insurance covers without the hands down. No problem. No questions answered. Asked.
Good. Now, what about the overweight patient? Like if somebody's 70 pounds overweight?
That's another huge advantage of this procedure, because we just use a longer guide wire. So it doesn't provide as much challenge as open surgery tackling. Obviously, it takes slightly longer, but not that much longer. So obesity for this surgery really doesn't matter. Comorbidities, obesity, and other high BMI, those factors don't matter as much as.
So these high BMI patients, these 80 pounds, 100 pounds, 150 pounds overweight patients, because you can't do traditional fusion surgery on them, you just have to give them medications? Like you're almost turning them into...
They become opioid dependent. They're pain medication dependent, and as you know, Randy, pain medications are very addictive, and it doesn't really solve the fundamental problem. So we are able to help many patients who are in severe pain. They cannot be helped by open surgery because they are such a taxing surgery. With this minimally invasive surgery, because it's a quick and it doesn't have as much complications. For example, open surgery infection rate is 5%. This surgery, less than 1 out of 1,000.
Okay.
In fact, I haven't had one.
Okay.
Several hundred I've done, which is huge. There's a 5% chance of getting infection with open fusion surgery, with hardware in there.
Now, do you have people that are back to sports after a fusion? This type of minimally invasive fusion?
Yes, I have many farmers I've operated on, even welders. I let him go on a tractor in about 3-4 weeks.
Really?
Open surgery, you cannot do that for 6 months at least. Okay, and I have many follow-ups. I'm from Minnesota, so I got a lot of hardworking farmers, self-employed farmers, and I have 1 or 2 year follow-ups on these patients after this minimally invasive surgery, fusion, and they all fuse, and they're very happy. Their pain goes from 9 out of 10 before the surgery to 0 to 2 out of 10.
How many people, let's say in Minnesota, right? Would you say there's hundreds of thousands of people that are in pain that don't have to be?
That's right.
Really?
That's right, because we can apply this high-tech, minimally invasive fusion surgery to those patients, and easier recovery, good outcome, less bleeding, less complication. Another example is I had this 35-year-old woman who had 3 back surgeries, and she was not able to take care of her children because she was such a severe back and leg pain. Okay, actually she was using a cane to walk around. So I did this minimally invasive surgery. It took because of prior surgery on her anatomy, I did about 2-hour minimally invasive surgery. She went home the next day. 1 month after surgery, she was ecstatic. She was able to take care of her kids and threw the cane away and off the narcotics. This is amazing surgery.
Because look, it's very topical in the news, opioid epidemic. So there's a lot of people that are on opioids that could wean off with this procedure. Is that true?
Many of the patients, if you treat the fundamental structural problem and not just masking the pain with the opioids or pain medications, we can get him off this,
Is that common?
Evil medications.
Is that common in your practice?
It happens quite often.
People weaning off those?
Yes, that's our goal. That's our goal. Because if they're still taking pain medications after surgery, the surgery is no good. It hasn't accomplished its purpose.
And thank you for coming on the show. We're almost out of time. I mean, look, you flew over here to California to this newsroom. I'm sure you had an idea, what is your main message? What do you want people to know about what you're doing with spines, with the fusions?
Well, fusions, we can do majority of these cases minimally invasive fashion, and 1 levels we can do as an outpatient and with minimal complications and a good outcome.
What about 2-3 levels?
I've done 6 levels. It takes longer, but 2-3 levels I would probably do it as a overnight stay at a regular hospital.
But still, that's not much. I mean, 1 night in the hospital instead of 5, and
That's
the
right.
downtime is very low.
That's
even
right.
on these 3 or 6 levels.
Much lower.
So we're talking about necks and backs. I call it low back, mid back, and
well,
the neck.
we cannot apply this technology to the neck or the. I'm just talking about the low back. But as I discussed, most of the fusions are done in the low back, in the lumbar spine.
I wanted to ask you about scoliosis. Can you do scoliosis minimally invasive?
You can do scoliosis minimally invasively, yes.
So if somebody's watching this, and hopefully this will not air, it's going to air on TV, but also on the internet. Mm-hmm. Do you think people will probably be a little bit skeptical? Like they're going to say, "Why didn't my doctor tell me this?" Because
it's not a common surgery yet, as of yet. it's at the beginning stage. I think that's the reason why you haven't heard so much about this surgery. But we are doing scoliosis surgery applying this technology, and bleeding is less and recovery is quicker.
What's the oldest patient you've operated on with a fusion? Is it the 91-year-old?
Actually, I've done an open surgery in a 100-year-old, but that patient stayed in hospital 2 weeks.
Okay.
So if I use this minimally invasive technique, I should have gone home the next day.
Really?
Knowing what I know now.
Because look, everybody knows. I mean, you don't have to be a genius. Everybody knows avoid spine surgery. But if this is a minimally invasive way where you're just pushing things out of the way, low downtime, and if you get results, it means if your pain is diminished, why not?
Yeah, we can apply this technique to a lot more patients.
What if somebody had a failed back surgery, and we are really short on time, but what if somebody had a failed back surgery that they did? Could they, and they need a revision or they need more, can you do this? Do you ever work on those type of patients?
Yes, I do lots of, failed back surgery patients who said previously failed spine surgeries. Yeah, this is a great technology to apply to those, this limitless application of this technology. And this is coming from a guy, I've been around 32 years and doing 20,000 spine surgeries, so I have the right perspective. 32 years is a long time.
Okay, and I didn't really ask you this way, but look, you've got a lot of before and afters in your head. You've done tens of thousands, or 10,000 plus surgeries, 15,000, 18,000 surgeries the other way that's currently being done. And you've met the several hundred patients you're doing with this minimally invasive. Is it noticeably different as far as how they feel, how they act, how they respond?
Yes, that's my opinion.
So like no comparison?
There's no comparison. For the right indication, you have to choose the right diagnosis, but
you're not a cherry picker, you said.
That's right.
In medicine, I learned this from you guys that sometimes if it's too risky of a surgeon and it goes against the surgeon's stats, they may not want to touch it. You're not afraid to tackle the most complex cases. That's what somebody said about you.
That's right, because I've been in practice for 32 years, and my goal is to help patients. And many patients are in great need, and it does take some complex techniques to help them, but I'm not afraid to tackle them, because my end goal is to make them feel better, pain-free. That's my goal.
Doctor, I want to thank you for coming on the show. Great stuff. Time flew by for me.
Thank you.
And if somebody wants to know more, they could go visit Inspired Spine, learn more, and maybe they could see you, Dr. Abbasi, or one of the team. So thanks again.
You're welcome.
You've been watching the Wellness Hour, news that makes you healthier. I'm Randy Alvarez. For now, I wish you good health.
Thanks for watching the Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.